So our first panel of the day focuses on health in our community, an issue that directly impacts workforce readiness, quality of life, and economic competitiveness. Today's discussion will explore current healthcare challenges and advancements in our region, as well as the importance of collaboration between our providers, employers, and policymakers. Serving as our moderator is Amber Hernandez. Amber is the Chief Nursing Officer at Doctors Hospital of Laredo. She is a Laredo native, and she brings deep experience in emergency and acute care and is widely respected for her collaborative leadership and commitment to strengthening healthcare as a cornerstone of community and economic development. Joining her on the panel are Mr. Oscar Buitron. He's the Chief Executive Officer of Clear Choice Health System, with extensive experience leading community health organizations and expanding access to care across our region. Please welcome Oscar Buitron. Our next panelist is Elmo Lopez Jr., Chief Executive Officer of Gateway Community Health Center, whose leadership has driven significant growth in primary dental, behavioral, and health services across multiple counties, ensuring care for patients regardless of income or insurance status. Please help me welcome Elmo Lopez Jr. Our next panelist is Mr. Jorge Leal, Chief Executive Officer of Laredo Medical Center, whose tenure has been marked by major investments in clinical programs, advanced technology, physician training, and expanded access to care for the Laredo-Webb County community. And our final panelist here is Mr. Eric Hamon. He is the President and Chief Executive Officer of Driscoll Health System, who oversees one of the state's leading pediatric healthcare networks and brings extensive experience in hospital operations, healthcare finance, and regional health system leadership focused on empowering outcomes for children and families all across South Texas. Please join me in welcoming our moderator and panelists as we begin the Health in Our Community discussion.
Good morning, everyone.
Morning.
Is everyone awake with this cold weather? Let's go ahead and get started. Welcome to Vision 2026. We want to thank the Laredo Chamber of Commerce for bringing leaders together that shape our community not only socially and economically, but also medically. Healthcare is not only about hospitals and clinics, it's about workforce readiness, economic competitiveness, and quality of life. In today's panel, Health in Our Community, we have 4 great CEOs who each collectively touch care in Laredo, whether it be through emergency services, preventive care, pediatrics, or acute hospital services. We want to thank each one of you for being here today and for your great leadership. My role here today is going to be very simple. I'm going to guide an honest, forward-looking conversation about where healthcare in Laredo is now, where the gaps still exist, and how collaboration, not competition, moves us forward. As mentioned, for those who don't know me, I am Amber Hernandez. I work closely with healthcare systems, clinical teams, and community partners here in Laredo. I am the Chief Nursing Officer at Doctors Hospital, and I am honored to moderate today's discussion. This will be a conversational panel. I'll guide the discussion, but I may invite others to jump in and respond to each other or build a point. Please look at my nonverbal cues. I might gently interrupt just to keep us on time. So we're going to go ahead and get started with our first question, and this is going to be for the entire panel. When we talk about healthcare in our community, what does success actually look like for Laredo 5 to 10 years from now? And we can go ahead and start here with Mr. Buitron.
Great question. I think success in healthcare for the next 5 to 10 years is really targeted on increasing access to care. Why? Because there's currently lots of outmigration that's happening in healthcare. On an annual basis, about $300 million is siphoned out of Laredo because residents from Laredo decide to seek care elsewhere. Whether it's San Antonio, whether it's another place in town. I think the future is bright in healthcare over the next 5 years if the intent is to increase access to care, which is exactly and precisely where Clear Choice is headed. The strategic plan is to open up more emergency care, open up more access for inpatient, for surgical suites, operating rooms, having the best of the best in our imaging suite when it comes to CTs, MRIs, mammography. Mammography, yes. Why mammography? It takes about 2 to 3 months in Laredo to get an appointment. And that's one of the reasons why outmigration occurs. And I think in order for healthcare to have a prosperous 5 to 10 years, the intent in healthcare is to increase access to care, which is precisely what Clear Choice is doing.
Thank you. Now, Mr. Lopez.
Thank you. First of all, thank you for having me and our distinguished panel. We're all friends. We've worked together before, many of us, and I'm honored to be here. At Gateway Community Health Center, and I agree with Dr. Buitron, we do need more access. What I see in 5 to 10 years, our needs and what will become a reality, I believe, is we'll need a pediatric hospital. We will need a behavioral health inpatient hospital. And we need continued recruitment of physicians and nurses and doctors and dentists and behavioral health specialists into our community. That's what Gateway Community Health Center is doing. We just got our mammography machine, and it's the next day appointments, Dr. Buitron, so send us your patients whenever you need to. Gateway has built 11 clinics now. We have 2 mobile clinics, and we're trying to increase the access for primary care. We're not a hospital. Just think of us as a large doctor's office or a large dental office. We have Laredo's largest pediatric practice. We have 10,000 children in our practice. We have 5 pediatricians, 4 nurse practitioners, adult medical, adult dental, and just think of us as a multi-faceted practice. We are federally funded, mainly to take care of our uninsured population in Laredo, but we also take insured patients. Let me repeat that. We take insured patients. We take Medicare, Medicaid, Blue Cross Blue Shield, Aetna, Cigna, all the teachers, federal government employees come to us for primary care. So we will do our job to continue to recruit into our community, which we have and continue to do, and we will continue to create that access on the primary care side. And we will help our partners get more inpatient services that we need badly here, because I agree with Dr. Buitron, we have a tremendous outmigration of patients to San Antonio, Houston, Dallas, the Valley, for care that should be given here in our community.
Thank you, Mr. Lopez. Mr. Leal?
I didn't know this was a marketing campaign for all of us, so I'm going to do it too.
Yes, it is.
But
take advantage of it. And Monica said we're here
So-
an hour for...
We'll be doing it, but no, really, I think when you think about the role of Laredo Medical Center, 132 years of history, but where I see the 5 to 10 years of what we want to see from us, I think the maturity of our residency programs, as we continue to talk with Access, with Oscar and Elmo, we're talking about, yes, we're all going to be creating more access points, more of the needs that are for our community. The numbers that they're quoting are correct, 40% in many different areas. But it's not because our physicians don't want to do it, it's because of the lack of physicians that they do. I always tell people, you want to see a hardworking doctor, come to Laredo and you will see one of the hardest working physicians and APPs that we have. So that's never going to be our commitment from the physicians, independent, non-independent, it's there. So that's why when we did that investment with our partners here with Gateway back in 2017, we really did change healthcare for our community. And now we have, we've graduated 5 classes, 24 doctors have stayed in this community. One of those, Dr. King over there on the right, Dean over there. Thank you, Tyler, for being here. But for us, really, you got to go back to clinic later. I'm kidding. But anyways, when you look at what we're starting to get from the specialists from the internal medicine program, you're going to start seeing it. We have our first gastroenterologist that is already going through it. We have some that are going to cardiology, infectious disease, nephrology. All the specialties are going to start to mature, but this is a 10 to 15-year process. We signed it in 2017, first class in 2018, so you're going to start seeing that. So that's humongous. At the same time, from the access points, from growing south, east, west, there's so many places that we want to make sure that we got to do that. So for us here at Laredo Medical Center, we take that commitment seriously. 132 years of history. I know the where I get to walk because when the Sisters of Mercy picked Laredo to change, that is what we get to do every single day. And for us, it's about making that healthcare experience exceptional for all of our patients, for each other, and for our community. So for us, that's really where I see where healthcare is going, and I'm really excited to talk about some more here shortly. So thank you.
Awesome, thank you. Now, Mr. Hamon.
Thank you. I'm going to mix it up a little bit, and my reputation is I go off script a little bit, so I'm going to do that. I have a trivia question. Can I do one trivia question?
Of course.
Okay. Who and how much in 1904 bought a portion of the Alamo in San Antonio? Anybody? It's $1,000 for the answer. Clara Driscoll for $75,000 in 1904. To answer your question, I would echo some of the things that my colleagues have said and would agree that healthcare is local. Nobody wants to leave their hometown for healthcare, so I think success would look like in 5, 10, 15 years would be to set a goal today of where you want to be in 5 and 10 years, set metrics, and hold yourselves accountable to meet those. From a pediatric side, Driscoll's been coming to Laredo for 15, 20, 30 years and have added services. And if you ask me, is it enough? It's never enough. I think if you have the attitude and you talk about gaps and what's needed, it's never good enough. And I think if you have that attitude, then you will always, always improve and get better. That's good for the kids, that's good for the adults, it's good for the community. Specifically on the pediatric side, I think the key, if you can get kids started out correctly on the right path for healthcare, it's going to make Jorge and this team's job easier on the adult side. So I would want to really work with the community and my colleagues to get more general pediatricians to this market. It is very underserved and would want to spend a lot of time on prevention. While we have 17 different specialties coming to Laredo, in a perfect world, you would want to work with the pediatricians to prevent them from going to the specialists. So I would really want to put a lot of effort over the next couple of years of recruiting specialists as well as pediatricians, and then have those specialists and pediatricians come up with a plan to take care of the kids.
Great answers. Thank you, gentlemen. I think we're all looking forward to the next 5 to 10 years and those advancements. So now I want to move on with Dr. Buitron. I want to start with you because emergency care is often the front door to healthcare. So the question is, emergency care plays a vital role in community health. What innovations or operational improvements has Clear Choice implemented to improve access and reduce wait times in Laredo?
Improve access and reduce wait times. You know, nobody likes to wait. Nobody likes to wait at a restaurant, at a gas station, certainly not when it comes to healthcare. Clear Choice was built with the idea that emergency care should be fast, it should be reliable, and it should be patient-centered. We have streamlined many operations at Clear Choice. When you come in and register, almost even before you register or almost immediately, you're being called already into your patient room. Within minutes, you get to see a physician. We have clinically integrated technology that allows our physicians to diagnose quickly. You diagnose quickly, then obviously you reduce unnecessary admissions, you reduce unnecessary long ER stays. We are locally owned and operated, and that kind of gives a unique twist. We're able to reinvest back into our community, into our infrastructure, our staff, into our patients. We're able to pivot a lot faster. We're able to do and implement operational changes a lot quicker. And when it comes to improving access, 2 weeks ago, we just had a groundbreaking. We are expanding our ER location of Bartlett into a neighborhood hospital, right? I just mentioned, right, we're adding more access to inpatient beds, to operating rooms, state-of-the-art imaging. I think Laredo doesn't have to leave once we finish our expansion to have their imaging done anywhere else. We have the best CT, the best technology in CT Laredo has to offer. Once we expand and add our MRI, we'll have the best MRI technology we have to offer, and everything else. So I think we've done a lot of strides and a lot of improvements to help reduce wait time and increase access.
Definitely, and I think we all feel it here at home. I do want to ask a bridge question. I'll start off with you, and then I'm going to add Mr. Leal to kind of give us feedback on his perspective. How do freestanding emergency facilities help relieve pressure on traditional hospital emergency departments?
That's a good question, Amber. And I think independent freestanding EDs, specifically, Clear Choice, we all have our mix in healthcare. And I think we definitely relieve some of the congestion or some of the pressure from traditional hospital traditional hospital emergency rooms. We provide a lot of services. We have a lot of non-critical patients. We have a lot of mid-acuity cases that we see, and that definitely frees up traditional hospital emergency rooms. So I think independent freestandings definitely have a mix into reducing that congestion.
Thank you, Mr. Leal.
Yeah, I mean, I think for us here, I think in the community, I think it was 2015 when we had the first freestanding that was non-independent. Then Doctors Hospital came, and then we did it. And then just like that, I believe there's 9 freestandings when you think about it. I think the role for us here in the hospital is how we accept these patients via admissions or coming or surgical admissions. So there is just a lot of that. So absolutely, I do agree the congestion. I remember when you would walk in and you would see people waiting. That's really stopped. And for us, really, is our pledge to see patients fast, seeing everybody that comes in through our doors, and that's important for us. But accepting, we always say, no pay, best pay, it doesn't matter. Whoever comes in through us, we're going to see them. I know our partners at DHL do the same. So, but when you're asking about the access, it really is when we didn't have it in some areas of the community. And now emergency services are going over there because those minutes matter, from stroke, heart attacks. All of those are so important. And the investments via private equity, corporate owned or local owned, those are the investments that really are saving lives. And if you go back, and I hate to go back to COVID, when COVID happened, we got to all partner together, and it didn't matter what color you wore, we all were the same ones for Laredo, and we all got to work together through all of that. So yes, the freestanding emergency rooms are completely important as an access point of your hospital or your community, whatever it is, but seeing everyone coming through your doors is the most important piece of it. And I think as we start specializing to see more from pediatric care to other geriatric, and I think the one thing that we don't talk about enough is our mental health deficit. And as we see more and more, we see patients, I'll give you a perfect example. We had somebody had been in our hospital for 88 hours waiting for placement. So I think it's just one of those things when you look about the deficit from the state level and local level as one of the largest cities, and sorry, I'm going off tangent, but when you think about the behavioral deficit that we have in our community, something that we really got to focus on, and as ERs, we take on a lot of that.
Definitely, and I agree, and I think the right people are in the room because it not only takes healthcare leadership, but it takes also community leadership to bring that type of service here into our community. So if anybody's going to take anything back home, definitely mental health is something that we really do need assistance with here locally. So moving on, I'll stay with you, Mr. Leal. So as Laredo's largest acute care hospital, your system carries a different kind of responsibility. What major service expansions or specialty advancements has Laredo Medical Center made to reduce the need for residents to seek care outside the region?
Thank you. That's an excellent question. So for us, Laredo Medical Center, we're part of Community Health Systems, and we're very blessed because I would say we have 70 brothers and sisters across the country. But just in the past 3 years, we've invested $60 million in Laredo, from a freestanding emergency room to state-of-the-art cath labs to now an inpatient rehab, a brand new women's imaging forum. So now we have state-of-the-art mammography, stereotactic, women's health being one of them. First in Laredo for us to have just dedicated to women. So for us, that was really exciting. So when you start thinking, where do I see for us investing in from the access points, I think that's where we take that very seriously. Because when you look at beds, we're trying to do the preventive piece to not come to the hospital. As a hospital CEO, you would think, I want heads in beds. But that really has changed. It's really about the preventive care and why we've invested so heavily in our primary care. When we started, I'll give you an example. When I got here in 2014, coming back to my community, we had 2 employee physicians. Now we have 33. We have the largest primary care practice here in the community, and we're not going to stop. We're going to continue to grow that panel because it's important for them to see more in their offices. When I talk with Tyler, with Mario, regardless, Dr. Bang, it doesn't matter. Like, we're trying to see how we're going to keep these patients healthy because whenever you don't start from the beginning, and it's really hard to come back because you start getting comorbidities and so many things, and we'll be ready for you at the hospital. But when you start looking at where do we see and where do we add more, that's really where we started thinking about the freestanding emergency room. We went to Southeast Laredo, which I'm so excited about the growth that's over there with Cuatro Vientos. And as you see that growth, you're going to see how much that community is growing. And you look at Northwest Laredo and just all the areas that are missing access. So that's why we're looking from primary care clinics, walk-in clinics, and specialist care, which we are continuing to recruit on that. One of the things that either hospital, there's only 1 or 2 of the specialists. So I think that's where we're recruiting very heavily on the specialists to make sure that, as we were mentioning, that no people have to leave Laredo unless it's specialized care and they're coordinating. But I would say, like, why are you leaving? It's like, oh, because San Antonio is better. And I say, how come? Oh, because it's San Antonio. And am I doing feedback here? No. So for us, it's important to take away the excuse by bringing the specialists, having the technology, and just doing a lot of the things that are needed for this community. So for us here at Laredo Medical Center, it's so important to continue that journey. We're entrusted with a lot of that care. And when we get, we're the lead level 3, so that means we get about 80% of EMS traffic in the city. So a lot of that time is important for us to get. So for our partners with EMS and Laredo Fire Department, it's as you walk in, know that our team is ready to take on whatever the trauma or whatever it is happening in that ambulance by partnering also with our local partners in Doctors Hospital and all the others from the freestanding emergency room. Sorry, I'm getting feedback here.
And one more question, and I'll move on. But now, I don't know if it's me or if it's you now. Where do gaps still exist?
So definitely I'll say on the specialist piece. I think whenever you look at the specialist, it's the onesies or the twosies. I'll give you a perfect example. When Dr. Estrada passed away back, Ricardo Estrada, who was a mainstay of the hospital, when we lost him, we lost our neurosurgery program, just like that. It took over 1.5 years to recruit somebody, and that's when we're very excited. Now we have Dr. Chu. And then when you think about what doctors has done with Dr. Park and Dr. Tabacoli, this is the collaboration that we got to do. It's not going to be one of, oh, it's just here, it's just LMC or Doctors Hospital. And I'm very thankful for the relationship I have with Andrew, that I can call him. There's many, Andrew Wilson, the CEO at DHL, I can literally pick up the phone and call him, hey, this is what's happening. And Elmo said it perfectly. While we all compete in the same space, it's all working together. There's going to be things that Oscar can't do. There's things that I can't do, and I'm going to be calling Eric, Mike. There's a lot of things that you have to work together and work on the same sandbox together. We partner together in our residency program and do it well, and the result, the proof's in the pudding. What we're doing, it is working. But when you look at what's missing, really is the specialists, when we need to have more, and to reduce those wait times. Right now in orthopedic care, if you were to hurt yourself and wanted to call for an appointment, it would be probably 3 weeks for somebody to see you, and it's not good enough. So we're going to continue to recruit on that. because we also see retirements coming along. And we got to make sure that we take care of that population. It's not just orthopedics, it's every single service line when you look at it. I believe we're 220 physicians short when it comes to primary care, pediatricians, and family practice being about 120 of those, so, and the rest being specialists. So that's where we're going to continue to recruit when it comes to primary care, which is the baseline of everything that does. And then from there, going into the specialist care, and then into more specialized care when it comes, when you think about from the surgery piece, that is a huge piece, not just general surgery, but vascular, colorectal, breast. I mean, there's so much that's happening that you got to continue to do here.
Thank you. And I think you hit a great point. Hospitals can't do it alone. Preventive care is equally as important, and this is where Mr. Lopez comes in. With our community health services, they are also the first line of defense. So what unmet needs are you seeing most frequently among patients in Laredo that you all service?
Before I continue, let me just ask all that are involved in healthcare to stand in this room just to be recognized. All that are involved in healthcare. And my point is that healthcare is economic development. Please stand. Please. All that are involved in healthcare. Thank you. And I'll recognize individually because the Lopez family is doing all they can to bring healthcare access. My son, Elmo Lopez, is the market director for Laredo Physicians Group at Doctors Hospital. My son, his beautiful wife, Sarah. And our chairman of our board of Gateway Community Health Center, Mr. Tony Arce, is in the audience too. Tony, thank you for your leadership. What we're doing to increase preventive care and our deficiencies, first of all, I agree with Jorge and Oscar, we need more physicians, we need more pediatricians, and Gateway is doing all it can to recruit. We also need more access points. We're doing all we can with the help of the federal government, Congressman Henry Cuellar, and I need to give a special shout out to Representative Richard Raymond. He's been very instrumental in helping Gateway move forward. Richard, yesterday we just got a $1 million incubator grant to finish up our Mines Road clinic, and thank you very much. So, Richard, thank you. With the creation of access, more clinics, we bring in more physicians, more nurse practitioners, more dentists. We have clinics in Zapata, Texas, a very rural county. In Zapata County, we have access there. We have access in Hebbronville, Texas, Jim Howe County. It's 4,000, 5,000 in population, and we're the only clinic left in Jim Howe County. We don't want to be the only clinic, but that's where we are today. And so we're creating that clinic access so people do not wait to seek out a physician or a dentist or a behavioral health specialist here at Gateway. So with that in mind, we have 35,000 registered patients already and growing. 60% of our patient mix are insured and 40% are uninsured. And that's, I guess, my point right now. This is the business community. Laredo has one of the highest, if not the highest, uninsured population in any community in Texas. 30% of our community, our population has no health insurance. It's not an indictment on what we do here. We're heavy in international trade, and the 37,000 employed in international trade, most do not have health insurance. So we have that issue. The state average for uninsured is 15% of the population, anywhere you go, Dallas, Houston, San Antonio. So I think over a period of time, that's going to help if we get more insured patients. That's going to help the recruitment of specialists because they depend on insured patients to pay the bill. So it's a business thing that we need to work on, all of us in the business community, I think. So it's not only doing the preventive care that we do, having access, we have night clinics, etc., but it's also having that ability for patients to pay. We fortunately have that ability to welcome patients. We're not a free clinic. We charge, but if you have no money, no job, no insurance, $25 to see a doctor, $50 to see a dentist. And if you don't have the money when you come to your appointment, we put on a payment plan, $1 a week. The government doesn't care how we do it as long as we attempt to collect. So it's a very open clinic. We turn no one away, and that's big for our communities that we serve.
Thank you, Mr. Lopez. And I think you mentioned access is very important, but it's not the most important thing. As a preventive care organization, I think education is instrumental. So how do you all educate that community to be able to be healthier in our community?
We have, for example, we have 20 health promoters, community health workers in our clinics, of which I am one. I'm a state certified community health worker. I give classes on diabetes self-management, on many other topics. We have classes for our patients morning, noon, and night. It's an education piece that we have to do on preventive care. People have to know how to manage their health themselves. It's not just the physician or the dentist or behavioral health. They have to also take ownership of their health, which many of our patients are doing because of our education process. And also creating access not only to the medical, behavioral health, and dental world, but we have in-house pharmacies with discounted medications. It doesn't do anyone any good to go see the doctor and not be able to afford your medication they're prescribed. And we have that in-house. We also have in-house labs so that you can get your blood drawn and get checked on your blood. And also we have radiology, ultrasound, and mammography now that creates that access for our patients. So it's all under one roof, and you don't have to go anywhere else. Even though Neto has those services available, we are the largest practice in Laredo.
Thank you for the information. We all know now that we can go and educate our community as well. And moving on to our pediatric population, Mr. Hamon, pediatric care is unique because it impacts the last decades. So what advancements has Driscoll Health System brought to Laredo that are changing long-term outcomes for children and families?
You know, that's right in the middle of my fairway. I would say that about 8 years ago, Driscoll developed a partnership with the local hospital providers in the neonatal intensive care unit. Our market is from Port Lavaca to Eagle Pass South, and we manage about 225 units. And so what we've done is we've set regional and national standards and goals of how to improve outcomes for these kiddos. And we've added in the market maternal and fetal medicine. And so for those of you that don't know what an MFM is, they're an obstetrician with 3 years of extra training. And so what these MFMs do is they sit down with mom and baby, and if they're high risk, either the mom and or the baby, then they'll want to take that mom to term. And so what that does is that improves the outcomes both pre and postpartum. In addition to the units that we manage, we provide consultative services. For example, if that kid has a cardiac issue, we'll have our specialist, our cardiologist teed up so that when that kid's delivered, we can handle that care. And so we've seen a significant improvement in moms going to term and improvement on the outcomes for these kids in the Laredo market.
And where do you feel we're still falling short? What specialty do we still need for those pediatric population here in Laredo?
You know, if I had to nail down, so right now in Laredo, Driscoll has 17 specialties coming to Laredo. We've seen a pretty large trend. You know, I'm going to go back 3-4 years. If you went back to 2021 to 2025, we were seeing in Laredo with those 17 specialties about 13,000 outpatient visits. Fiscal year 2025, it was 20,000, which is about a 50% increase over that 3 to 4 years. Is 20,000 visits enough? It's not. As I indicated on my earlier remarks, it's never good enough. We should always try to get better. If there's one of those 17 that we need to add prospectively, I would probably choose oncology. Oncology is one of those specialties where it is a very, very specialized area. And to bring that product to Laredo, you would want a good partner such as my colleagues up here, and then add, you can't just add pharmacy, a pediatric pharmacy. It has to be a specialized pediatric pharmacy for oncology, for lab. And so I think that is a very much needed specialty. and that would be one that we'd want to add in the near future.
Definitely. Thank you for that. And I'm going to move on to slightly to the business community in the room. I am going to ask one last question before we move on to audience questions. Just make your answers short, as I want to give an opportunity to each one of you. Access to quality healthcare is often a deciding factor for communities considering relocation or expansion. How does your institution contribute to making Laredo more competitive in attracting talent and investment? So we'll start with you, Mr. Buitron.
Yeah, I think the premise really is going back to creating access, right, to expanding. I think everybody in this panel has talked about expansion, has talked about opening up new locations, and that really is the premise to improving healthcare in the community so that we can continue assisting the residents and so that we can continue to provide the healthcare services that we need here in Laredo as opposed to people leaving Laredo. So I think again, going back, it's creating that awareness, it's creating access, it's bringing in more services, more physicians, and much better technology in town.
Mr. Lopez?
Thank you. Yes, I agree with Dr. Buitron again. We are also creating access and hiring the right people as far as primary care is concerned. We have doctors, the nurses that we have, they're all well-trained. Many of them come from our residency program that we partner up with the Laredo Medical Center. We have 24 family medicine residents at any one time and 24 internal medicine residents. And for the first time in our history, we're creating our own physicians. Some of them are born and raised here in Laredo. They come back, they go to the residency, and they stay here. And that's a big deal. And Dr. Tyler King is one of the great examples of our residency. Tremendous leader in our community, and we want to continue that trajectory. And I think that's going to be attractive to anyone wanting to relocate from out of town, to have that knowledge that we have the services, whether it be Clear Choice or Doctor's Hospital or Laredo Medical Center, and all the outpatient services that we have from Driscoll are very, very important. We need more. We need a pediatric hospital. I'll say that again. We need a behavioral health inpatient hospital. You can't have outpatient services, and you have to wait to send those patients that are our patients that are in the ER waiting for placement to San Antonio, to the Valley, to Corpus Christi. It's not good for that patient that needs services immediately. So behavioral health is going to be big, and pediatric services will be big in the future. Laredo has the largest percentage of children in the country. 30% of our population are kids under the age of 18. That's about 100,000, maybe 82,000, 83,000 came out in the Laredo Morning Times. The bill is here. So we have the population here that needs those services. So if we're going to attract outside industry and those managers and the high-level personnel that go with those industries, we need to have these services in the future.
Well said, thank you. Mr. Leal?
I'm going to take a different approach on this because we've all talked about access, but we cannot do what we do without creating our own nurses. So I want to give a big shout out to Minita at Laredo College, to Dr. Maynard at TAMU with our nursing program. And the fact that they've listened to us when we've been in meetings, we're now going to start creating our own lab, medical technologists. I'm a son of a lab director, so my mom will tell you, you cannot have a hospital without a lab. So, 4 years from now, we will start having medical technologists. We have creating our own ultrasound, X-ray. All of that is, you got to start with that. And then I'm going to go even before that because I see Julie Bassan back there. The area health education is such an important part of what we do here. And you got to start with that baseline of creating that workforce. You want to talk workforce? Yes, we're talking physicians. But you cannot have a hospital without those technicians and also therapists. And we're also big shout out to Adriana Nunemaker with UT because we're now having outpatient therapy. We're having other programs that are coming to Laredo that are going to have our own PA program. So there is a lot of access that's being created, non-physician related, and this is where we put our investment And all the health systems here are investing by paying for the educators so we can create with no commitment, like, oh, if we pay, you must send us your nurses. That's not it. It's because we believe in the development of a young workforce so we can continue to replace. So one of the things, and we got to make sure that we recruit them, that we retain them, and that we allow them to grow. What that is humongous for us to continue to grow as an institution. And there's so many, and for our young TEMU table back there, please take notice of this, because our program that we have here is very, very influential in the things that we're doing to continue to grow towards the future. So for us here at Laredo Medical Center, and I know all my partners here, it really starts with workforce development and by creating our own. So I'm excited about that, and of course continue to recruit doctors. But if we don't have those, we can't have a hospital.
Thank you. Mr. Hamon?
I'll add to what Jorge said. Driscoll's approach to recruiting, whether it's a physician, a nurse, a technician, or maintenance, and what we've learned is a success, is that what employees, our future employees want, is they want an organization that's moving forward, an organization that has a vision. And so I wouldn't call it a secret sauce, but what we do and when we recruit is we describe where we're going. We spend a little bit less time on the rearview mirror. I think that our approach is the windshield's a lot bigger than the rearview mirror. It's where you're going, and creating an opportunity for employees that we're going to grow and we're going to continue to get better has created an opportunity for, and Sarah's here, she's at the Driscoll table. It is hard to recruit, and it's going to continue to be hard to recruit. But over the last 12 months, we've recruited 60 pediatric specialists across the South Texas, and our goal is to recruit another 60 and just continue to grow and take care of the kids. So I think that employees really want to see that you're moving in the right direction, and they want to buy into your vision of where you're going.
Absolutely. Thank you very much for that. And I do have a couple of minutes, so I want to open up for any audience questions. Here you go. Yes.
Okay. Hello. Thank you. I promise, Jorge, I have patience this afternoon. I took a half day. All right. But no, thank you so much. Just have a quick question, and this might be for Mr. Hamon, or
Sure.
Here you might be Mr. Hamon. No, okay.
Hamon?
Just in case anyone
I've
accidentally
been
calls
called
you.
a lot worse. Go for it.
In case anyone accidentally calls you that, there is something I really wanted the community to start talking about and considering, and that's a hospital district. Of course, that's something that only a county can do, and I'm a city official, and I can't, I don't want to necessarily force that conversation onto them, because a lot of the hospital districts that are successful in Texas got started in the 1950s and 1960s, like Bexar County, El Paso County, and I guess you're out of Corpus Christi. I know there's a hospital district there. It started in the 60s. And the community wants a hospital, a pediatric hospital. We want inpatient psychiatric care. We do have a high uninsured population. Could you or anybody else on the panel who has knowledge of hospital districts throughout the state, and these are separate entities that are essentially, people think hospital district means building 10 new hospital buildings, but really it's it's actually a new entity, a new government body that could raise funds for the people who aren't aware. Could you see a hospital district benefiting a community like Laredo, Webb County, that doesn't have one? And if so, how? Yeah.
I think that, what you would want to do is, look out and ask yourself, what is it that you want the hospital district to do? What is it going to be their role relative to what the other provider hospitals are doing? Once you answer that question, I think it's going to be a business question for the community, because not all, but most that I'm aware of, hospital districts, what they do is you're going to have to get the community comfortable with a tax. And so I think if you can get the community comfortable with the tax, you would want to identify what type of income on an annual basis would that generate, and then decide based on that income, what could that hospital district do? Would it be different than what the other provider hospitals are doing? Would it be a partnership? But I think there could be potential value, but I think, step one would be to, get through the community and get support for the likelihood of an incoming tax. And I think if you can get through that, for example, down in the McAllen, Edinburgh area, it wasn't necessarily a target for a hospital district, but it was for a medical school. And there's a medical school down in the McAllen, Edinburgh area. And the success of that medical school was to try to tax. It wasn't a hospital district, but it was call it a healthcare tax. And it was one of those, at that time, the McAllen, Edinburgh, FAR, Wesco market was not supportive of that. So I think you would want to gather your business leaders and your community to get support. But I think it could be a really strong program, because in the state of Texas, I'm going to get, this is going to sound complicated, but there's a term called IGT. It's intergovernmental transfer tax, and that is what's used to fund the entire state of Texas for directed payments. That's important to all of us, for the most part, on this panel. And so there's some value long term, so long as the state of Texas continues to have a directed payment program that functions through that tax, there could be value. And I don't know if my colleagues have a different perspective, but I think it's possible. But you're going to want to get community support.
Thank you. Any other audience questions?
Hi, good morning. Thank you all very much. This was very interesting. I agree with everything that you all said up there, especially when it comes to recruiting physicians. So my question is, what has been your biggest hurdle or the hardest thing about recruiting physicians to Laredo? In my experience, because that's what I've been doing the last couple of years, is selling the city, the idea of somebody who's not from here to bring their family and to work here in Laredo. A hospital is a hospital, an OR is an OR, a clinic is a clinic. You've seen one, you've seen them all. So we've started to pivot to doing a community tour, really selling Laredo. I'm a firm believer that Laredo's the best city in Texas, and I say that with all sincerity. I think we have the best people here. We have great schools. We have great restaurants. We have great nightlife. We have everything that a city could offer, and yet it's still extremely hard to bring doctors and to recruit doctors here. And I think a lot of that is, you Google Laredo today, this morning. Just open your phone and Google it, and you have to kind of go through a couple of negative things before you get to something positive. So we at Laredo Physicians Group are trying to break through that and show them how great Laredo is to work and to live. So what has been your experience in recruiting doctors?
I'll take this one. So I think it's perception. So whenever you get them past the, I always laugh because when they show Laredo, like when they show Mexico on a movie, I feel like they put a different lens. They make it yellow. Unfortunately, we're not very green in Laredo either. But when you start thinking of what Laredo has to offer, there's so much. And the one thing that I tell folks is, if I get somebody to agree to come to Laredo, we're batting about 70%. But we got to get them past make sure that they come. If it's a woman physician, which we don't have enough, but we're creating more, that her husband comes. Or if it's a physician, that his wife comes. And make sure that they build a community. I can tell you one that we hired, he couldn't believe that we flew his entire family to Laredo. And he goes, why are you, because those kids are going to join our schools. They're going to be playing in our sports. They're going to be part of our community. And that was the deciding factor, because we decided to make the whole experience inclusive of what they were going to join into what the fabric of Laredo is. So that is so important for the growth. So for us, Dan, same thing, what we're doing. Every time we're trying to sell Laredo what it is, from our incredible schools, be it public, be it private, to what it is from the higher education to what we're doing as a city to continue to grow. I used to make the joke that back when I was in high school, our cool restaurant was Outback. You all remember, it was the cool restaurant. But if you think about how we have grown outside the chains and all the local restaurants that we continue to have, and just the access that when it comes to having that experience, I tell people, go enjoy your 2 hours in San Antonio and get that brunch spot that you want, but come back to Laredo and come back to your 12-minute commute to work. And that is humongous. But the other part that I tell physicians that join it, you don't have to be employed, is that when you're coming, you're not just a cog in the wheel. You are helping us shape healthcare and helping us build programs here together. Because you're not just one of 20 general surgeons, one of 30 orthopedic surgeons. You're one of 10, and you're really helping us shape that experience. And a lot of the doctors want to do that. And then throw into the residency program and says, and you get to teach residents if you want to, some don't, and you get to shape healthcare minds. That is something that really, for us, it's a really good selling point to make sure. But I like to say 70% is what we're batting, but we got to make sure that we get them here. Once you're past the headlines, that unfortunately things happen. But I tell people, when I believe we have 15 murders in the city last year, that's just a weekend in Dallas. And I'm not throwing shade in Dallas, but like Laredo's a very safe place to be. It's a great place to grow up. And when you see the people that I say, go get your experience, go to college, enjoy other communities, but come back, make us better. And that's what really makes this community special, because we're so tight to each other, and we all work with each other at one point. So that's what makes it great.
I want to just add to that.
Yes.
I agree with Jorge. We're recruiting families, not just the physician and dentist. It's the entire family. We do the same thing. We fly or bring in all the families, kids, wife, husband, and we have used some of our local resources, and it's helped amplify the, I guess, the good things that we have in Laredo. We use Sandra Lanis. We've been using Sandra in the real estate firm for the last 3-4 years. She takes every recruit that we have, the families around Laredo. She gives them a tour. Of course, she's being the past president of the chamber. She knows all the historical areas, and people are impressed. And typically, they will agree to sign a contract with us. So we're very happy to recruit, and using our local resources, we take them out to local restaurants as a recruitment tool. We go to San Telmo and all the other restaurants. And that's big, because they get to know what we have here locally. And it's really typically, you only have like one shot. You have one weekend. You have, because they're going several places to be recruited. So we try to use our local resources, and it's helped quite a bit.
Thank you all. Definitely, I think Laredo is great. We have time for one more question, short answer. So go ahead.
Yes.
Thank you. Good morning, everyone. Good panel, excellent presentations on each and every one of you all. Let's talk about demographics and the makeup of our population and the health care being provided to our population, which is on average a young population. The big gorilla is the cost for businesses like us, the rising cost of health care. I'd like to hear from you all your perspective as to the trends of what's going on right now, because if we don't, as businesses, can't control those costs of health care of our workforce, which has already taken off in the last 10, 15 years for us, it just continues to skyrocket. So that you all can provide the adequate health care, how do you measure, that cost, rising cost, versus actually our population that we have, which is younger, or even the aging population, which is about 10% of our demographics, in the mental health care side versus the pediatric health care side, and the rising costs?
If I can just add, thank you, Jerry, for the question. First of all, we have to educate our very limited insured population. We only have about 10% of our population that has commercial insurance, not Medicare and Medicaid, just the commercial insurance. The banks, the school districts, LC, TAMIU, and this is what we're getting from our large insurance broker. They're coming to us to say, you need to help us educate the insured population, the commercial, because everybody's abusing. They have insurance, they're going to Jorge's ER, Doctor's Hospital ER. And for example, one of the school districts had a teacher last year, 2025, go to the ER 17 times for strep throat, flu. I have a muscle ache. That's about $5,000 each visit. Your healthcare costs There's one school district that pays $50 million in premiums. The other school district pays 40. The city of Laredo pays around $25–30 million in premiums. Those are double what normally should be paid because of the tremendous abuse of not knowing that you need to go see a doctor for your preventive care once a year. Just get a baseline, take your blood test. And that's where that education comes from. And it happens to all the businesses. I think it's a collaborative issue. We have to do the educating. Jorge, Oscar, Eric, everybody has to educate. If you have insurance, this is the way you should be using it. Everybody should have a PCP. 60% of the teachers in this community don't have a primary care physician listed in their insurance. So consequently, they feel bad on a weekend, they go to Jorge's ER. Great service, by the way, but it's $5,000 every time you walk in.
So this
And
is where
that's
I
why
kind of
Jorge-
interrupt you this time.
They said short answer, Elmo.
Yeah, okay.
They said short answer, Elmo.
Anyway, take
Wrapping
it away,
it up,
Jorge.
any
Take it
other
away.
short answers, please?
So it really is establish a relationship with a primary care physician. That is a big thing. To what Jerry was saying, I mean, that's what we're trying to control costs when it comes to that, to make sure, as Laredo, as you heard, 75% of Laredo is under Medicare or Medicaid, 12% on the commercial, and then the 13% uninsured. So that is the big thing, to make sure that they establish the primary care relationship, be it starting pediatrician or into growing. And that's what really the commitment is from, I think, from all four of these panel, to make sure that they establish that baseline till they can have a yearly check-in. So
10
I agree.
seconds.
I think preventative
10
care.
seconds. In your, this is going to sound simple, but it's complicated. Your healthcare costs begins with you, so take care of yourself and those around you. The more you take care of yourself and the more that you take care of those around you within your family, your workers, that type of thinking and prevention will keep you out of the hospital.
I agree. Preventative care has a lot to do with it. I also agree, however, that emergency care does play a role in healthcare. But it's not just really the healthcare entities, it's the health plans. You know, I was recently denied a service from my health plan because they considered it unnecessary. I think prior authorization has gotten to a point where it's not allowing physicians and it's not allowing healthcare entities to take care of patients. So I think it's a little bit of everything. I think it's a little bit of what, everybody said in here at this panel. But let's not exclude healthcare plans as part of the solution as well.
Thank you, definitely. Thank you, gentlemen. We want to thank our panelists for your leadership and transparency, and for Laredo Chamber for creating this space and allowing us to have these conversations. So thank you.
Thank you.
Thank you. Thank you. Thank you, Oscar.
Awesome.